State Senator-elect Liz Miranda. We are so excited to have you with us at our virtual conference this year. Thank you so much for taking the time. At MPHA, our work is guided by two explicit commitments: to dismantle structural racism and to listen to the voices of those most impacted by oppression and health inequity. And so the theme of our conference this year is rooted in community building equity-driven policies, which of course led us straight to you and your work.
Thank you.
In your 20 years as a community organizer, you've worked to break down silos and tackle housing, environmental justice, reproductive justice, policing practices, and more. How does your lived experience inform your legislative priorities in the House and now in the Senate?
Well, first, thank you, MPHA. New digs for you. Super excited that you're an organization that I value so much, and really excited that I get to say Senator-elect in January, say Senator after a 10-month campaign, and I'm proud to be your senator. It feels good when someone lives in your community and is doing great work. You know, I often joke that I've been a Black woman from Roxbury for 42 years, and I've only been a legislator for 4. And so everything in my life's experience has led me not only to be a legislator, but to also be a person that focuses on my lived experience, right? And so I grew up in the Dudley Triangle. For folks that don't know about that neighborhood, there are 2 movies, Holding Ground and Gaining Ground. I'm in Holding Ground, and you'll see me much thinner with lots of curly hair. And in Gaining Ground, it talks about what DSNI, the Dudley Street Neighborhood Initiative, which was started in the 80s here in this community in Roxbury, really did. And there's a book called Streets of Hope. And when I look back at those films and I look at the book and I read it from time to time, I keep it on my home desk. Every time that I have like a Zoom to go on, I'm reminded about how everyday people can change community. Now, the Dudley Triangle had 1,400 parcels of vacant land. We had legal and illegal trash transfer stations. We were redlined. We had the highest concentration of brownfields. And most of the people who lived in this community lived here after people burned their homes for profit or did the white flight thing after busing, right? And so Cape Verdeans like my grandparents came into this community because it was affordable, right? No one really wanted to live in this corner of what they now call Mass and Cass, where Roxbury meets the South End, Dorchester, and South Boston, near South Bay. But that experience of growing up in that community and getting involved with DSNI when I was 13 and Nubian Roots has totally shaped my whole life. And I didn't know then. My first job was in the Dudley Environmental Action Leaders. And I was 13. I lied about my age. I needed a job. So I said I was 14 so that the city could pay me. But thankfully, I got that experience. And I have my office today on the same street where I walked as a child, the same street that I walked to DSNI, and also where I went to elementary school. And just to be here today, knowing that 25 years ago I fought for bus stops and trash receptacles, and now there actually are trash receptacles and bus stops, and we have a lot less vacant land. I don't think I knew then that that was environmental justice work. I don't think I knew then that I lived in an EJ community, but I did know that people had power to transform their communities that were long degraded or disinvested in. And so I think it's in my blood, and I always tell people, when I was a kid, I wanted to run and not be in this community, because when I told people I lived in Roxbury, folks treated me a certain way, right? But now that I get to be the legislator of this community and I have a home that I own a block away, have an office on these same streets, it reminds me every day that the work that we're doing to change the lives of the 7 million people in the state of Massachusetts is very real and really on the street level. You know, sometimes you could be in that building and forget because it's Golden Dome, it's pretty, it's got marble floors, but it impacts people's lives. So I just would like to say that I think that my work is deeply connected to my lifelong story.
Well, we won't tell anyone that you lied about your age to get paid by the city. But I'm glad that you touched on environmental justice. At MPHA, we have a powerful partnership with Alternatives for Community Environment, or ACE, a grassroots environmental justice group that's based here in Roxbury. We have been working with ACE for a long time on transportation and climate justice, and right now we are focused with them on air quality. And as you know, residents of color in Roxbury, Greater Boston, and statewide experience greater exposure to air pollution and are more likely to suffer poor health outcomes as a result, like lung cancer and asthma. Can you talk a little bit about your priorities in the next session related to environmental justice?
Yeah, I was just talking to you earlier about, I lost my dad in February. He had really severe COPD, oxygen dependent, and then passed away of lung cancer. And my dad was a smoker. And if you know anything about the 70s, 80s, and 90s here in Roxbury, they promoted smoking heavily in our communities, in the housing developments in our communities. And, just right now, I just thought about, my dad being a smoker likely led him to get COPD and lung cancer, but he also worked in a factory doing literal back-breaking work, and then lived in a community where the asthma rate was 5 times higher. We had a lot of buses. I know the work of ACE for a long time. I went to high school in Roxbury. I walked through Dudley Station for decades. Buses idled in our communities. We live near the highway. We have a very low percentage of trees. And so the heat island effect and the lack of a tree canopy is a very prevalent thing. And when I talked about those trash transfer stations, there was dumping everywhere in this community. And so health equity, I was honored to be appointed to the Health Equity Task Force right before COVID really got into full swing. And we knew then that we would have to really work on transforming the public health infrastructure in the Commonwealth, because we know which communities were going to get sick, and we knew which communities would pass away. And all those factors led, I think, to my grandmother passing away the first month of COVID. We didn't know what it was then. And I think our communities have long been screaming that our zip codes are killing us and it's man-made. And so I'm hoping in the Senate that I not only work on health equity in terms of maternal health, food justice, being an active member of the EJ Roundtable, but looking at asthma and air quality all through the Second Suffolk, because I grew up in Roxbury, but these challenges are also in Mattapan. These challenges are also on Center Street in JP. These challenges are in the South End as well. So anywhere in the urban core of the city of Boston probably has issues with air, and we should live long lives. We should live in safe, healthy communities. And if we're dying at 59 when someone 4 stops on the number 1 bus gets to live to be 90 or 92, there's something very wrong about that, and for us not to do something about it.
You touched a little bit on the trash transfer station issue. I know that you are currently working on removing a trash transfer station from Roxbury. Can you talk about that work and why environmental infrastructure is so important to EJ communities?
It was really interesting because folks have told me that I'm a long way away, but just to share with this audience, because I know you guys will do something about it, is that we have 1 remaining trash transfer station in Roxbury, in the most environmentally unjust community in the entire city. 100% of Cambridge's trash comes to Roxbury, and about 30% of Boston's trash comes to this neighborhood. No one wants to live next to a trash transfer station. And so for those of us that have been living in this community forever, we know that trash needs to go somewhere. We know recyclables need to go somewhere. But why is it in our community? It doesn't smell good. They don't take care of their property. And so I just recently had a meeting with Mass DEP, and I was really fortunate that we had my other colleagues, Senator Nick Collins' office, Representative Santiago's office, Frank Baker's office, and then we had Mayor Wu's administration to really meet with Mass DEP, who regulates these trash transfer stations, to say we want them to do better in the interim, but we don't believe that it's okay for Cambridge's trash or even the rest of Boston neighborhoods to be coming to our community, because this community is where there's mass and gas. The trash transfer station, we still have issues with asthma. So if we're going to get better, we actually have to mediate and remediate and mitigate all these environmental injustices that we faced. Now, I've lived here since 1980 when I was born, but there have been people in this community for a very, very long time, and these injustices have carried. So my goal is, they've told us that they haven't gotten many complaints, and I am hopeful that I can energize this neighborhood to write letters and send emails and make phone calls to Mass DEP to say that we no longer want this in our community. No one should live next to a literal trash bin, because we've been the figurative trash bin for most of our lives in this community for the rest of the city.
You've touched on this as well, but we know that zip codes are closely correlated with health outcomes. In the early days of COVID, you've already talked about this, our neighborhood here was a global hotspot for COVID cases. And in your first week as a state rep 4 years ago, you said that advocates presented you with a statistic that stopped you in your tracks, which is that 6 out of the 10 zip codes in Massachusetts with the worst maternal health outcomes were right here in your district. How are you planning to continue the reproductive justice work that you've championed in the House as you transition to the Senate?
You know, what's really interesting is, like, I want to thank Pat Haddad, who was Speaker Pro Tem at the time, convened all of the freshman women legislators in 2019, like our first week. And we were in the bullpen, so I was super excited to be able to, like, get out of the bullpen and go somewhere. And there goes March Dimes, who does this presentation to all of us. I think at the time, Rep. Lugardo and myself were the only 2 black women in the room. And the data was just so bad. And I remember thinking, as I'm reading and looking at the numbers for Roxbury, Mattapan, Dorchester, South End in particular, that I was like, I don't have a child. I was like, am I going to die? You know, I want to be a mom one day. And I already know all this stuff about my community, but I didn't know that. I came to the State House with a mandate on my heart and my head to work on gun violence. I just lost my brother 6 months before, and 6 months before running for office. And so it was important to me that I came in with that. And I was like, oh, shoot. I can't, as a black woman, I looked around the room, and they said that in Massachusetts, arguably the best biotech entrepreneurial sector, hospitals, colleges, public health infrastructure in the world, that black women were dying 2 times the rate of white women here. And so I walked out the room. It's a short walk to the elevator, and I was just consumed by emotion. And I think mostly because of the presentation, but what really happened internally, besides this fear that had overcome me, was that I had been reminded in that short walk that in 2017, my sister gave birth to a baby, Mila, at 21 weeks, who didn't survive. And I watched her give birth, and I, for 24 hours before, watched my sister struggle in pain, call her doctor, and her being told, you're anxious, take Tylenol and take a nap. And my sister gave birth in the wee hours of the morning the next day, because she said, you know, I thought my doctor knew best. It's my first kid, you know, like maybe I am anxious, but her pain wasn't listened to. And then I thought about my friend Jamina, who 2 weeks after giving birth almost died with septic shock because she kept complaining about pain, and her doctor said that it's normal. And they came to find out that they had actually ruptured something in her intestinal wall that had been essentially seeping into her body. And then there was my cousin Maria, who was giving birth alone and didn't have anybody. And because she has a great job like me, she was able to hire a doula last minute to help her through the process, and understood after she gave birth, like, how many other women don't have that. And so I think most people now know me as sort of the maternal or birthing justice champion for birthing people, because those experiences and those feelings led me to pass the Maternal Inequities Commission with Senator Roush and Representative Khan. The commission worked for a year. It's the only commission in the state that's ever been 99% black. It included practitioners, those with lived experiences, those in public health, those who were doulas, those who were midwives. It goes on. And that report was released in April, and I'm looking forward to that being the bedrock of me doing a birthing justice sort of omnibus bill in the first few months in the Senate. But it's all because stories matter. And I say to people all the time, I don't know how this happened, but I like to think that one of the strategies that I've employed in the State House, I didn't know how to write a bill when I first got there, and I've passed 5. And I'm proud that they're all interconnected with equity and justice, whether it's the 2-1 EJ, offshore wind and codifying EJ into law, whether it's the Maternal Inequities Commission, whether it's the police reform bill or jail-based voting. These are people who are marginalized and disenfranchised, who need people like me. But the stories of my sister, my friend Jamina, my cousin Maria, the March of Dimes data, I can't begin to tell you how many rooms I would share my testimony about why the commission needed to happen. And I guess that's why I was voted on unanimously, positively. And there wasn't one family impacted, right? I remember my Republican colleague, Hannah Kane, stepping up and talking about losing her daughter. Now, folks a lot of times say, well, you're a Democrat, you're like the AOC of mass politics. So like you're way left, right? And then to have someone who's in a different party, who is from Swampscott or like a community that's highly resourced, unlike mine, to say that this matters too, and knowing that if we work to help the most marginalized, we actually help everybody. And she understood that. And it's been a labor of love to share these women and these partners' stories, and folks who are in the LGBTQIA community, folks who are coming back from incarceration, folks who were pregnant while incarcerated. All these folks were able to share their stories about how we can improve birthing justice. And it is a matter of public health. It is a public health crisis when one community is dying, regardless of income, regardless of zip code, and regardless of educational attainment. So those 50 years that have passed has not changed maternal health outcomes. And so what we can say is the reason is just medical racism and negligence. And that racism is deeply embedded in what we teach people and how we teach people to respond to Black and brown people's pain, or medical care or access to health care, and their communities that they're going back to that are high stress, unsafe in many cases, unhealthy in most cases, and then they're expected to give birth healthy. That doesn't happen.
Thank you so much, State Senator-elect Liz Miranda. We are delighted to be able to continue working with you in the next session. We are excited about our policy agenda. I don't want to scoop the next segment in our virtual conference, which is going to talk about that agenda, but if you would leave us with the top 3 things that you're most excited about for the coming years.
I think one is just the honor and privilege that I get to serve in the Senate as the first Cape Verdean woman in the country. The amount of Cape Verdean pride, Roxbury pride that I bring to my work, that whole heart and hustle that it took to get here and survive some really tough times in our neighborhoods with gang violence, with the crack epidemic, now with mass incarceration and a multitude of issues is something that I'm hopefully excited to impart on my other Senate colleagues. I think most people in the House have enjoyed working with me as someone who's a straight person who's always looking out for the underdog in their communities. But I'm super excited that health equity has gotten the attention it deserves. I'm one that believes whether it's food justice or the built environment, they're interconnected to everything in our communities. And we've got to stop ignoring the fact that structural and systemic racism plays a part, right? And I love people that work in public health because you acknowledge that and you've made it your priorities. And so I'm just excited about being a face, a senator who can represent the 180,000 people who live between the South End and Hyde Park. And technically everyone that lives in the Commonwealth of Massachusetts that is looking for a champion for making our communities healthier, safer, and full of opportunity. So that's what I'm really excited about.
Well, thanks again for joining us in conversation for our virtual conference.
Thank you.
We'll see you in, I guess, 2023.
2023. Yeah. Have a great conference, y'all.